is that we're going to do a sinus lift, a lateral approach with sinus lift here. Here is the sinus, and we have another one here. We're going to do a lateral approach, we're going to do a sinus lift, we're going to do bone grafting, and we're going to place 3 implants. That's what we're going to place, 1, 2, 3 implants. So let's get to it.
Okay, so on this case, as I already explained you what we're pretending to do, one of the complications that we had on this area, see the ridge of the bone that we have, this line that we have here, that's the sinus. We don't have no bone here on the sinus, and we have a huge gap. With this gap, this patient was pretending to have teeth on that side, and we couldn't do a bridge from here to here, because this is a wisdom tooth, and you will need to hold all the way to the lateral, so it's going to be a large bridge. So if we're pretending to place implants, we don't have no problem here, but here, see how the sinus is? We need to do a lateral, we decide to do a lateral approach, so we can raise this area, do a lateral approach, we do bone grafting, and we're going to place at least 3 implants here. We don't want to go all the way to the back due to the position of this wisdom tooth, and see this patient has all the way to this wisdom tooth, so we don't want to do that. So it's 3 implants we're going to place here, and then on the other side we're going to do an extraction here, as I'm going to show you. We're going to already place the implant here. We're going to do another lateral, and we're going to place an implant here. Here we're going to have to do the same thing with the bone graft. So let's take a look. This is the X-ray, the way that we place them. We're putting vertical to the other position of those roots. Vertical, we did the lateral with the bone grafting. See how beautiful it looks there. All of them are bone level, and we're going to have, again, we're going to restore this type of implants. My suggestion is to work with the 3 of them fused together. You don't place them individually, because if not, remember that there's a story with this type of patients. Something broke those teeth that used to be there. That's the bite, obviously. The masseter, see, the masseter used to be a very strong masseter that destroyed those teeth that were there. So now that we're going to have restored teeth here, we don't want to have that amazing strength on that area and that big crush on this area. So what we want to do is that we're going to fuse these 3 implants together with the abutments. The way that we can do that is with plastic abutments. We can make a combined procedure that is going to be a metal porcelain. That's going to be a hybrid that we're going to do PFM here, and we're going to connect the 3 of them. My recommendation is always to use the screw retained. If this patient opens really good the way that it is, I recommend to make them screw retained, because that way you can unscrew them, give service, and put it in again. So with chimneys, this would be an amazing procedure. If you're going to place a cemented bridge here, the only problem that you're going to have is that if you want to give service to this bridge there, you cannot take it out, and you need to break it, and you need to start again. So my recommendation is to do it with chimneys. On this side, what we did is that we placed an implant. See, we barely reached the sinus here. We're near the canine, but it's more due to the angulation of the panoramic here that we have, and we did another one. There was not enough space for a second one. Here we only place 1, and the way that it works is that we have 1, and we're going to place the abutment and crown later on, and it's going to be a successful procedure. On lower area, see, we are bone level here, and we're going to have an amazing layout of the crown. 3 months after, on this type of procedures, like this one and this one. But when you have a sinus lift and a bone graft, there's always recommended to wait at least 6 to 8 months. Depends on the conditions of the patient, how's the health, and also the age. That's very important. Okay, so this is the case of setting 6 implants. At the same moment, we did an immediate extraction, and we placed those implants on here. Bilateral sinus lift and 6 implants. Bye.